So what we're going to be talking about is changes in the brow and forehead, changes in the upper eyelid skin where there can be an excess of skin, a condition that's called ptosis, which has to do with weakening of the upper eyelid muscles, which kind of creates a heavy, droopy upper eyelid. A very common concern is lower eyelid bags, and we will talk about how these lower eyelid bags really have quite a lot to do with loss of facial fat, meaning that what makes these bags sequentially more and more noticeable under the eyes is that around them, the fat that was camouflaging them is gradually going away. And then, of course, changes in skin elasticity. So, again, here's an example of a woman. It's pretty clear that she has fairly droopy brows. It's also fairly clear that she has lower eyelid bags. And you can see that there's a little bit of hollowing of the cheek. Part of why these bags are visible is there is less volume around it. And of course, you see some loss of elasticity in terms of that crepey, wrinkly, crinkly skin. Again, a younger woman, her eyebrow position is good, but she does have some excess skin and maybe some excess fat in the fold of her upper eyelid. Doesn't truly have lower eyelid bags, but she maybe has a little bit of loss of skin elasticity, a little bit of crepiness of the skin. Again, different situation. Here, this is what ptosis is. Ptosis is a situation where the eye looks like it's half closed. It can be on one side, it can be on both sides. This is really not anything related to excess skin. This has to do with the weakening of the upper eyelid muscle. And in contrast, this is her normal eye, so you can really see that difference here. And again, there's some loss of skin elasticity. There's, wrinkly and crinkly skin around the eyes. Now, why is it that the eyes are usually the first place that show wrinkles? The reason for that is they have the thinnest amount of collagen anywhere on the face to begin with. So because they have the least amount of collagen to begin with, as we age and as we lose collagen, they're one of the first places that show that sign of collagen loss. A number of things going on here, some excess skin, lower eyelid bags, loss of fat around the cheeks, and again, maybe some loss of skin elasticity as well. In general, patients with darker skin tend to have less wrinkles as they age. Part of that is genetic. Part of it is they kind of have an inherent sunscreen. The darker your skin is, it's kind of like you're always wearing SPF 45 or 60. So that's part of that reason. Again, this is another example of eye bags, but you can really see the hollowing underneath it, which then accentuate those bags. A number of things going on here: droopy eyebrows, excess eyelid skin, fat prolapse, lower eyelid bags, definitely some volume loss in the cheeks, and definitely some loss of skin elasticity. So the reason why I'm kind of going over all these findings is that in most circumstances, when you rejuvenate the eyes, there's not just one thing that is going to fix the problem. Because usually, as you saw with all of these examples, most patients that I see, what is aging their eyes is multifactorial. It's not just one thing or sometimes even two things. Sometimes it can be 3, 4 things that are all happening at the same time. Let's talk about the procedure. So first one is a brow lift. This is one of the most common things that patients are confused about, whether they need a brow lift or an upper blepharoplasty, which is an upper eyelid lift. A brow lift really helps lift that hooding in the upper outer corner of the eyes. A good test to see if you're a good candidate for a brow lift is to just put your finger kind of near the hairline above the brow and gently lift. If you like the look of what that does, then that means that you're a good candidate for a brow lift. So here is an example of a patient who came in because she thought her eyes were heavy. She thought she needed an upper eyelid lift. And, we pointed out to her that, listen, you really don't have much excess skin here. And we kind of did the simulation of the eyebrows being higher. She says, yeah, that's what I want. That's exactly the look that I'm going for. I like to see that more open arch look. So this is her after a brow lift. So 0 skin was removed from here. This was all done from above by lifting the brow and the forehead. This is one of the examples that I showed you. And again, we did not do anything to her lower eyelid bags, but again, she had a brow lift, and again, 0 skin was removed here. This was all done from the top. So now an upper blepharoplasty, or also known as an upper eyelid lift or an upper eye lift. So this procedure actually does remove skin directly from the crease and sometimes fat, but it does not lift up the brow. So it does not change eyebrow position at all. So here's an example of someone, she has very nice eyebrow position. There's really no need to do anything with that, but she has excess skin and some excess fat. So this is basically by just trimming away some of that excess tissue. The incision falls beautifully right in that crease, so it's a very easy place to hide the incision. Here's another example. This is a patient that I showed you, and we said she had some, wrinkling of her under eye as well, which she elected not to treat, but we did remove the excess skin of her eyes, and you can see it's just, makes things a little bit more open, easier to put on eye makeup, mascara. And again, it does not change the eyebrow position. So ptosis repair is the procedure that helps with kind of that closed eye look that can be pretty asymmetric at times. It really is not about removing skin. It's really about tightening the muscle layer. And again, here's an example of pretty severe ptosis on this patient's right side, and this is it afterwards. No skin was removed to achieve this. This was done by tightening that internal muscle layer. I think I put this talk together a year or two ago. We actually have a medicated eye drop now that can help correct ptosis. So we actually formulate that here, and it's a drop that has about a 6 to 8 hour duration. So it's great if you have an event or you're going out to, dinner and you want to, put a drop in each eye. It makes a very nice difference and makes the eyes look a lot more bright and open. And it wears off, but it's a, very safe and effective way to, correct this issue. The way this eye drop works is the medication gets absorbed into the muscle of the eye through the mucous membrane of the eye. And there is some variation in different people's permeability of their mucous membranes, but, it's something that you can test, and, if one of you wants to try it out, you can talk to one of my assistants, and, we could even just put a drop of it in your eye. And that's what some people find, is that when they just put it in one eye, which is their bad eye, like you said, the bad eye becomes better than their good eye, and then they have to put it on both sides. So there are other things that will brighten your eyes in terms of reducing redness and so forth. This drug is so effective that if you don't have ptosis, if your eye position is normal and you put that in, you're going to look a little bit odd. Like you could get kind of the, the really big open eye look. And in fact, one of my staff, who shall remain unnamed, tried that, and she can attest to that. So yeah. So these are surgical repairs that are done by going inside the upper eyelid and basically tightening that loose muscle. The easiest way to explain it is it's a very thin muscle. I mean, it's almost like paper thin. So you kind of create a little pleat of that muscle. You cut that excess, pleat that you bunch, and you suture it together. So essentially you're shortening the muscle, not the skin. Yeah. So this patient here and the one before, neither of them had any skin removed. This was all done by tightening the muscle layer. Yeah. All right. Lower blepharoplasty. This procedure helps contour baggy lower eyelids. It's also called lower eyelid lift or lower eye lift. I typically do this procedure, I'd say probably 98% of the time, in combination with fat grafting, for reasons that I already mentioned to you, but I'll go over again. There are some circumstances where we do it in isolation, and I'll show you some examples of it. So here's a situation where it was a younger woman that had fairly okay fat content in her cheeks, and we just removed the eye bags. This procedure is done through the inside layer of the lower eyelid, so there's no cut on the skin. We actually go into the mucosal layer, so there is no scar with the procedure. It's essentially a scarless procedure. Facial fat grafting, again, I'll show you examples of it being done around the eyes in isolation, but majority of the circumstances which will follow, you'll see that we use that in combination with lower blepharoplasty. So what fat grafting is, it's basically harvesting fat, suctioning out small amounts of fat, usually from the lower belly or the inner thighs, and injecting that into parts of the face that need more volume. It's really minimally invasive procedure. The incision to harvest the fat is 2 millimeters, so it's really small. Usually in the bikini area. The injection of the fat is done with a special type of needle called a cannula. So there's no scars. It does not leave any marks. So this is one of the most common ways to rejuvenate the eyes. So in this situation, this was a young woman. She just kind of thought her eyes had lost a little bit of their luster and their youthfulness. When we kind of examined her, we saw she was just a little bit volume deficient here. So again, no surgery was done here other than fat injection. The only thing that was done was just adding her own fat, just removing half an ounce of fat from her belly and injecting that into the cheeks. And you can see it's not dramatic change, but it's a very pleasant improvement. It just kind of makes the face look more youthful. Each of us, every year that we age, are going to lose facial fat. So understanding that if you do nothing to your face, every year your face is going to gradually lose fat. What these procedures do is they kind of set the clock back. It kind of adds more to the bank, so to speak. The rate of fat loss is what determines how long it stays. So I've had patients who come back after 4 or 5 years and they feel like they're ready for more. I've had patients who come back 8 years for something else, and I look at their face and the fat that we grafted still looks better than it did when we did it, 8 years ago. So really, to some extent, it just kind of depends on the rate at which each person is losing weight. Of course, fluctuations in your body weight also affects that as well. You can't have anything more natural than your own fat, right? So all fillers, and we use a lot of fillers, and I think fillers are great, and you can do fantastic things with fillers. But one thing that a filler is it's not your own body's tissue. It's not natural. So that's number one. Number two, fat has the potential for longevity, like we were just talking about, because it's living tissue that you're taking away from one place and adding to a place. And not all of it stays, but generally 40-50% of the fat does stay. And when it stays for a longer period. Third reason is that fat has stem cells in it. Stem cells are cells that are very small. So if you think of a fat cell being like the size of a balloon, a stem cell is maybe the size of a pea. But these stem cells, when they're transferred into the face, they create a process of regeneration that no filler can do. So they actually help improve skin quality. They help improve muscle tone. Sometimes we see patients, even like their age spots and their broken capillaries kind of become less visible. So there are some significant advantages to fat that fillers don't have. So when you're injecting fat, the depth of injection is generally very deep. So you inject the fat on top of the bone, under the muscle. You generally avoid injecting fat too close to the skin. That should honestly be true with the fillers as well. This example, I want to show you, this is a woman who had lower eyelid bags and had some fat loss. My recommendation to her was to do her lower eyes and the fat injection. She didn't. She said, you know what, I kind of just want to do the fat injection and see what that does for me. So she got this result really by just the fat. So the bags were not removed. In this situation, we just injected around. So, again, sometimes that can be effective. Yes, you can see there's still some bagginess here. We haven't gotten rid of it, but it's just less apparent because of the fat. So the fat that does not survive, typically the body just absorbs it. Incredibly rare, but it can sometimes happen where you have to inject a little bit of steroids or something, but 99.9%, because fat is biological, if some of it doesn't survive, the body absorbs it. I mean, if you think of when you get a blunt injury to your body, like let's say if you run into a corner of a table and you get a crushing injury, that crushing injury typically involves losing some fat cells. But, the body just absorbs it, kind of recycles it. Yeah. I also want to talk about those skin texture changes that we were talking about. So the effect of collagen loss. So what we use to improve that skin texture is a procedure called laser resurfacing. And laser resurfacing is basically using a laser to produce a deep peel of the skin, which then as the body heals from that, it will generate new collagen and it will result in improved skin texture. So here's a situation. Again, I chose this picture because that's all she had done. Okay. So whatever you see here, it's not from fat grafting. It's not from any surgery. So this is just from laser resurfacing. And if you look at her skin texture, yeah, she still has some lines, wrinkles, but overall it's just smoother, and that is basically the result of increased collagen. Here's her full face photo. So again, you can see see that even some, age spots are improved. Some of the lines and wrinkles around her mouth are improved. So you can do these laser procedures around the eyes, or you can do them around the entire face. Here's another example of laser resurfacing. Again, fairly deep wrinkles. And again, we didn't get rid of all of them, but we can certainly improve by at least 50%, sometimes more. Again, this improvement in these last pictures comes from more collagen, from building additional collagen under the skin. Like CO2, erbium, YAG, we have one that has both CO2 and erbium. We have one that's a pure CO2. Any laser that's capable of peeling the skin will help with that. And what determines how significant the results are is the depth of the peel. And that, again, is something that there is too much of a good thing. There's a kind of a optimum level of depth you want to peel, because if you peel deeper than that, then, there could be problems. So the recovery for laser resurfacing is generally, in the order of 7 to 10 days. And by 7 to 10 days, you're not done healing, but you can, put on concealer, makeup, and, look presentable. How often you do them, again, it's almost identical answer to the question about fat grafting. It kind of depends how much collagen you're losing and, how much we set the clock back. So, again, because things like lasers and fat grafting are not surgery, we're not removing skin, we're not cutting anything, there really are not excisional procedures. It's okay to do them, multiple times. What's the most common frequency? I'd probably say 4 or 5 years. Usually they set the clock back enough that, you look better for at least 4 or 5 years. Yeah. Of course, where the individual is, especially with women, in terms of their menopause, makes a big difference. So postmenopausal women, because their estrogen levels are low, their rate of collagen loss is significantly accelerated. So what a 38-year-old with wrinkles will get from this procedure and how long it lasts will be different than what a 68-year-old person gets. So now I'm going to talk about some of the common combination procedures that we do. And again, these are just things aimed at rejuvenating the eyes. So you'll see basically combinations of everything that we were talking about. So here's an example of someone who had her upper eyelids done and laser resurfacing. So again, we talked about what the laser does in terms of improving the skin texture around here. You can see overall just, smoother skin. And of course, the extra skin around the folds, has been removed. So this is a very subtle, very natural procedure. But again, it was a combination of 2 procedures. The downtime is mostly dictated by the downtime of the laser resurfacing, which probably at say 7 days, 10 days, something like that. It's easy. I mean, it's almost like you almost really can do it over the weekend and you're fine. If all you're doing is the skin removal, it's really easy. Yeah, if you do that in isolation without anything else, it's actually one of the easiest recoveries that we see. All right, so again, I'm going to just quickly go through some of these combinations with you. So these are someone who had her lower eyes done with fat grafting. Again, very common combination. Again, lower eyes and fat grafting. So again, took the bags out, but you can see the volume that now frames the eye. Just makes the eyes look so much healthier. She had a brow lift, had her lower eyes and fat graft. Same combination, brow lift, lower eyes and fat grafting. This is a man. Upper eyes, lower eyes, fat grafting, and laser resurfacing. And you can see what a huge improvement she had in terms of how smooth, her skin is. She was in her late 60s. A man with ptosis and pretty significant eye bags. So we did ptosis repair, lower blepharoplasty, and fat grafting. Upper eyelids, lower eyelids, and fat grafting. And again, you really don't see any incisions with these procedures because, with the lowers, they're internal. With the uppers, they're in the crease. So we're just wrapping up. I have a few more examples of men. Again, this is a fairly large lower eyelid bags, but you can see the hollowness from the fat loss here, okay? So again, doing a combination of the lower eyes with the fat grafting makes the bigger difference than just doing the bags alone. Upper and lower eyes, fat grafting, and laser resurfacing. Again, you can see there was a lot of textural changes that were improved. Upper eyes, lower eyes, and fat grafting. Again, with men, they want to look natural. They want results to be subtle and understated, So again, generally, people kind of know they look better, but they don't know why, Yeah. And again, here's another example of a man with upper eyes, lower eyes, and fat grafting. And I think we're done. So just on time.